how are you all doing? So first of all, massive congratulations on your very exciting news. There is going to be really fun times ahead for y'all. My name is Leanne. I am the instructor of our Antenatal Pilates classes. So you're all very welcome to the antenatal program. And this is just a quick video which will just give you a little bit of an insight about Antenatal Pilates, what we're about, kind of like gentle activations of different muscles. Obviously all this stuff we'll go through in class, but just give you a little insight of what's ahead of you for the next block. Alright, so as you more than anyone else are very aware, a lot of changes occur during pregnancy, changes that are very visible and changes that are not so visible in the body. So we know as baby's growing, tummy muscles are stretching to allow for baby to grow, which will put an awful lot of extra pressure in our lower backs and in different areas of our body. Okay, so we look at Pilates. So what does Pilates do for us during pregnancy? So what Pilates does, it's a very gentle form of exercise. It's absolutely fantastic to kind of give you that 1 hour a week where you have an hour to yourself, an hour to unwind, an hour to actually breathe. Sometimes our lives are very hectic that we just don't have time to actually work on a couple of deep breaths in and out. So what it also will do, as we talked about different things, so abdominal muscles are stretching, a lot of pressure on our lower back. So it will help stretch out the lower back and all those areas where there's that extra tension within the body. So it also helps strengthen those abdominal muscles and helps strengthen our pelvic floor muscles. It will also maintain flexibility and mobility in different areas of our body as well. So as I said, it's just a general overall hour to do all those things. So our pelvic floor muscles, they are a hammock of muscles which go from the tailbone behind to the pubic bone in front. Okay, so it helps support the bladder, they help support bowel control, and they have to work really hard during pregnancy to require the weight of the growing baby. Okay, so a lot of time we know that we're supposed to keep our pelvic floor muscles nice and strong, but we're like, how do we do that? So a little couple of tips to do it. Actually, as I said, we'll be doing loads of this in class, but I'm just going to stand up here, okay? So as I said, they go from the tailbone behind to the pubic bone in front. Okay, so we think about our front passage and our back passage, okay? So we think when we're trying to contract our pelvic floor muscles that we're trying to stop the passing of wind and we're trying to stop the flow of urine, okay? So we're going to gently draw our back passage towards our front passage and draw up towards our belly button, okay? When we're doing that, the main thing is here, it's not going to be a really harsh contraction. It's just going to be a really nice, easy, gentle contraction. So we talk about maybe contracting them 30% or a 3 out of 10. So it's a really nice, gentle contraction, okay? When we're doing it, we want to make sure that our bum muscles, so our glute muscles, aren't really squeezing in with us. We're going to try to keep them as relaxed as we can. So I'm saying all this now, it's an awful lot to take in, but as we go through it in class, it'll become much easier. So, okay, we're thinking about, we're trying to stop the passing of urine and we're trying to stop the passing of wind. So we're gently drawing our pubic bone towards our tailbone and drawing up very slightly towards our belly button and relax. So bringing our breathing into it, we're going to take a deep breath in. As we breathe in, everything is nice and relaxed. As we exhale, we're tucking our tailbone towards our pubic bone and drawing up to our belly button. Inhale, relax. Exhale, pubic bone towards tailbone, draw up towards our belly button, inhale, relax. Okay, so you can practice that anywhere. It can be something that's practiced in the car on your way to work. It's something that you can practice when you're standing making the dinner. It can be something that's practiced in work, wherever, whenever really. But we'll be doing absolutely loads of that throughout class and it will be incorporated into loads of the exercises. So we talk about the contraction of the pelvic floor being really important, but we also need to know how to relax the pelvic floor muscles, and that's why we always say on the inhale, just relax everything. So the relaxation is just as important as the contraction, because when you come to closer to giving birth, we need to ensure that pelvic floor muscles are relaxed to allow baby come through. Okay, so we'll be going through this in depth throughout the next 6 weeks, okay? So that's okay. So we'll move on to our deep tummy muscles then. So we have our, sorry now I'm moving around this chair, we have our transverse abdominis muscles, which help support the lower back. So our transverse abdominis muscles go from just under the rib cage one side of the body all across to the opposite side of the body. Okay, so once we keep them nice and strong, they will help ease off the pressure on the lower back. So it also helps to manage diastasis recti. So I don't know if any have heard of that before. I'd say some of you have. A lot of the time, well, most of the time it happens during pregnancy to help facilitate the growing baby. Okay, so just to explain diastasis recti a little bit. So we have our transverse abdominis muscle, which is known as our six-pack muscles, one go down either side of the abdomen, and then we have tissue in between those muscles. So what diastasis recti is separation of the tissue between the rectus abdominis muscle. As I said, very, very normal to occur in every woman by the end of pregnancy. But it's just once we know how to contract our transverse abdominis muscles during pregnancy, it will keep them as strong as can be. And then following pregnancy, so postnatal stages, we'll find it easier as we know how to activate those muscles correctly to help you recover further on. Okay, so just talking about how to actually contract our deep tummy muscles. As I said, as baby grows, a lot of extra pressure putting centre of gravity off. We have all that extra pressure within the lower back. So we're thinking about contracting our deep tummy muscles just to help ease the pressure off the lower back. Okay, so what you want to think about doing is just, we'll talk about posture further on throughout our 6 weeks, but we're going to think about hugging baby in towards us and relaxing. So deep breath in, on the exhale, hugging baby in towards us, inhale, relax, exhale, draw in, inhale, relax. So a nice cue is hugging baby in towards you, or think about tucking our belly button in towards our spine. Another nice one I like to use in class is imagining we have a jeans and it's a little bit tight as we're trying to get that top button of the jeans closed, so we're just gently sucking belly button in towards the spine to contract those deep tummy muscles. Alright, so that's just our deep tummy muscles and a little outlook of how we're going to get those. And lastly, we're going to speak about breathing. So our main muscle involved in breathing is our diaphragm muscle. So it's just a dome-shaped muscle, and as baby grows, the diaphragm becomes displaced upwards into chest cavity, making breathing more difficult. We tend to rely on our accessory muscles then, so the muscles of the neck and the muscles of the shoulder and chest become very tight, which are already very tight due to change of posture during pregnancy. So in Pilates we teach what is called lateral breathing, which makes breathing more effective when you don't have much room to breathe. So it will enable mobility of the mid-back. Okay, so when we talk about lateral breathing, again, we'll do loads of this in class. We think about the rib cage, okay? So I usually cue people to push their hands just on the sides of the rib cage. So when we take a deep breath in, we're going to imagine, use our hands as that cue to push the rib cage out the way, allowing those lungs to expand. And as we exhale, feel the rib cage fall back together. So hands at the side, take a deep breath in to prepare, just and exhale. Okay, so what you can do actually first is you can close your eyes, just relax your hands, work on a couple of deep breaths in and out. Okay, what you feel, what you probably will be feeling, is the chest and shoulders moving and a bit of movement in the neck. Okay, so again, hands on the side of the rib cage. As we inhale in, feel those hands move out as rib cage expand. Exhale, feel those hands fall back together. Okay, deep breath in. Exhale, feel those hands fall back together. Okay, so on the exhale, so next time we're going to take a deep breath in. On the exhale, think about pulling baby in and up towards it. So squeezing baby in, giving it a big hug and relax. Okay, so deep breath in. Exhale, hugging baby in towards you. Okay, it's an awful lot to take in, but just give you a rough idea of where we're going. Okay, so that's just, I thought it was a quick little video, so but do you know what, hopefully it's interesting and you've learned something from the video and you'll be excited for the 6 weeks ahead. So I look forward to meeting you all, and we'll be doing loads of the techniques throughout the block. All right, thanks a million guys, and see you soon.